Alright, so welcome to the 13. Welcome to the 12 rather of our muscle anatomy question series, and let's look at it. A 23-year-old man is brought to the emergency department after being involved in a bar fight. An X-ray confirms a transverse fracture of the mid shaft for the humerus. This is the key point here. On physical examination, the patient is unable to extend his wrist or fingers. Sensory loss is noted over the dorsal aspect of the first web space between the thumb and index fingers. Which of the following motor function is most likely preserved in this patient? So this is a very critical condition that, in fact, it destroyed so many conditions of the guy's body. But let's start from the down. He says extension of the wrist. This is controlled by the muscle called the extensor carpi radialis, longus or brevis. It is supplied by the radial nerve and it is affected. Extension of the MCP joint of the fingers. Now this one is controlled by the extensor digitorum, which is distal to the point of injury, and because it is distal to the point of injury, it's going to be affected. Abduction of the thumb is controlled by the abductor pollicis longus, which is the muscle involved is the nerve is innervated by the posterior interosseous nerve of the radial nerve, right? So it is very affected. Now A says supination of the forearm. Supination of the forearm is controlled by supinator, okay? And supinator is supplied by the radial nerve, deep branch of the radial nerve to be precise, and it is affected, right? It's going to be affected because it is distal to the site of injury. Extension of the elbow is actually supplied by the radial nerve. However, the radial nerve branches to the tricep, the axilla actually, right? The tricep and the axilla before it passes through the radial groove, because the main shaft of the humerus is the nerve passing through the main shaft of the humerus is the radial nerve through the radial groove, okay? But for the extension of the elbow, it branches to the tricep muscles. That's in the axilla before it now moves to the radial groove. So it has supplied the axilla, the tricep in the axilla before it passes through the radial groove. So this muscle is actually spared, okay? So the extensor of the elbow is actually spared because it's from the tricep, and the tricep has been supplied. Even though it is radial nerve, it supplies the tricep in the axilla before it passes through the radial groove. So the answer is B, extension of the elbow. It's very, very quite tricky because almost all of them have the radial nerve supplied to them. So that's the answer. Thank you.